Steroid anti-inflammatory agents. These can be oral tablets, solution, IV or IM. They give short systemic administration of corticosteroids, and they're used on occasion in controlling pain. Used for localized injection into painful joints, joyful joints, for analgesic anti-inflammatory actions. Some side effects though: peptic ulcer disease, glucose problems, muscle atrophy, and degeneration of the bones. Anymore, steroids are being used commonly with back problems, or if you twist or tear, your back or knee or whatever, they may give you prednisone or an injection or something like that, just to try to reduce the inflammatory response. But again, you don't want to get used to it. Non-steroidal anti-inflammatory, drug of choice in tissue destruction, pain. These are used for acute, chronic, malignant osteoarthritis, arthritis pain, gout, migraine, and regular headaches. Those are things like Toradol, Naproxen, Motrin, Bayer, Celebrex. Is Celebrex still in the market? I thought they took it off for a while.
I've had it.
Did they take it off? Because I thought there was a lot of side effects.
I think you're right.
Again, a lot of people, if they can take their Bayer aspirin or their Motrin, they'll do that before they'll take anything else. Try not to get used to it. Analgesic synergy, that's when you use the two meds. The analgesic is better using two medications than using it separate. And there's combinations that you'll see, like Tylenol with codeine as an example. Sometimes when you've had a procedure, the doctor may order you Tylenol with codeine. Aspirin that's combined with codeine, that's Imperin. So on 243, you've got some examples there that depending on the pain, mild, moderate, or severe is what they would recommend. Hydrocodone, you can see they've got it in mild and moderate. Dilaudid, if you look, it's in the severe pain. Demerol, those would be more severe. But those are different ones that you'll see out there. Their dose.
I have a question.
Yeah.
On the oxycodone, AP, and ASA, I also had my first significant other passed away with cancer, and he was on a lot of the oxycodone. Does ASA, does that stand for because they had the slow releasing, and then in between the slow releasing at the end he would take quick release. Is that what that means there?
The APA or the ASA, if you look down bottom, it's like acetaminophen, aspirin, and codeine.
Okay.
But I understand what you're saying. There are some acronyms or letters behind.
One of them would be take this one every, and they were both oxycodone, and it would be take this one every 4 hours. But if he has pain in between that 4 hours, then give him this one. It's a quick release. So I found that interesting. It was quite a cocktail that he was on.
And if you look at, just look at the moderate pain there, or which one are we looking at? Severe pain?
Yeah, I was in the severe pain.
Yeah, if you look at
areas.
the Tylox and the Percodan there, if you look at it, the duration that it lasts, 1 to 2 hours every 3 to 4 hours, and the other one lasts 1 to 2 hours every 4 to 6 hours. So what they were doing is they were giving him one that kicked in, and when it was about to wear off, they would give him another one to kick in. So they were just alternating the ones so that he had continual relief.
Okay.
So by alternating. But yeah, I can see what that they would say.
Yeah.
Quick relief and that.
Yeah, it was just a crazy just mix of all of these.
Yeah. And if you think about your Atrovent and albuterol is fast-acting, quick-acting, but the Atrovent sometimes is given too, and it kicks in. It's still like a bronchodilator, but it kicks in just a little bit later. So sometimes the doctors will give a combo.
It isn't one, but I can't remember. I just remember the pharmacy on it a little bit. Like ibuprofen, one of them is metabolized in the liver, and then one of them is metabolized by the kidneys. You can rotate those quickly too.
Yeah, that's a good point.
That's what they tell you with the kids. Yeah, they do that with kids too.
To do both.
Every 2 hours you can rotate them.
rotate them.
They're different.
Oh, I forgot about that, see, my daughter's older, so.
How do you get APAP from acetaminophen?
Oh, down at the bottom, it just says abbreviations right underneath that
Yeah,
table.
but how does
I have no clue.
Okay. All right.
Your guess would be as good as mine there, Ed.
Thank you.
So you also have adjuncts to the analgesics. They're used with them, so compazine and phenegrin. So if I give the analgesic, a lot of times I give compazine or phenegrin to help with the nausea feeling that I might have. You also have tricyclic antidepressants, TCAs. They're actually using this a lot more to help with pain response, especially for individuals with chronic pain. And if you look at that table on 11-6, Zoloft is an example that I'm very familiar with, but also your amitriptyline. Not that I took it. Sorry. But amitriptyline is often used in diabetics for neuropathy. My dad takes that one because he has some neuropathy. When he was in the Korean War, he got, what do you call that when you're out in the cold? Well, he lost frostbite, and he lost part of the feeling in his toes and his feet, but he's also starting to lose it in his fingers from the diabetes. And again, my dad's 80 years old, but that helps with that, so he doesn't have that awkward feeling. So those are now being used to help with chronic pain. So it's not uncommon. It may not be for depression that a lot of people think of antidepressants. It may be more used for pain control, pain responses. Okay, I have a YouTube video if I didn't lose it. I want you guys to see this. This is propanol injection and how it works, because I thought how appropriate. Propanol is the drug that Michael Jackson died of. It is a white milky substance. We love it in critical care to keep our vent patients sedated. And it usually comes in a IV solution that hangs up, looks like milk. But the nice part is when you wean the patient off of it, they wake up very quickly, so they have little side effects from it. So it is a very good drug to help keep your patients stable on the vent.